Hi everyone, and welcome back to our channel, Make Believe Storytime. My name is Beatrice, and today I'm bringing you another inspiring interview, which is part of our series called What Do You Want to Be When You Grow Up, dedicated to preteens and teens. These interviews are designed to offer you a fun and interesting way of learning about a number of different jobs and career paths, some more traditional, some less so. In our previous episode, I spoke to musicians and twin sisters Anna and Maria Jula, who form a pop music duo. We talked about what a musician's life in London can look like, the benefits of music in our personal development, and the importance of a stable side income, among other things. If any of those sound of interest to you, then please do check out that interview as well. In today's interview, we are entering the world of medicine and the public health system. Today's guest, Elöise Clarke, is an actor turned nurse in training who is doing her practice in the public health sector. We will talk about what being a student nurse entails, how she came to the conclusion that nursing is the career path she wants to follow, and also what are the most challenging and rewarding aspects of the job. If this sounds like something that may interest you, then do stick around till the end of the video. Hi, Elise. Thank you so much for being with us today. I'm really excited about our conversation. And I hope you are too.
Yes, thank you so much for having me. Like I said to you before, I'm truly honoured for you to ask me, and I'm excited to talk about it.
Brilliant. I'm so happy to hear that. So we're going to start at the beginning, obviously. And so I was wondering if you could tell us a little bit about yourself and what you do.
Yes, so I'm Elöise. I am a third year student nurse. I'm studying adult nursing at the moment, and I qualify in September, which is very scary. But I don't think anybody feels prepared to be a qualified nurse. But I'm almost there, and I'm very excited to start my journey as a fully fledged nurse.
Brilliant. Yeah. I mean, it's so incredible because I know that you, before studying nursing, you studied acting, and that's how we know each other. So for me, to hear this sounds so exciting that you did went on such an interesting journey, and now you're going to be qualified as a nurse, which is really exciting. And I know probably a little bit scary, like you said as well. So I was wondering if you wouldn't mind just telling us a little bit about how did this change in direction come from career-wise, and what was the process for you?
Sure, yeah. So yes, I did a degree in acting before going on to nursing. I think when I was younger, I didn't really know what I wanted to do. I sort of went in between different career ideas. I think my problem is I want to do everything. I have so many different interests. I love music and dance and theatre, but I also love science and how our body works and, different things like that. So I think when I was younger, I really didn't know which direction to go in. And I remember watching some CSI program with my mum when I was younger. And I thought, oh, acting, that way you can be everything. You get to do every job because you can play every role. So that's why I went into acting to begin with. At the time when I was studying acting with yourself, we were living in Kingston, which is just outside of central London. And whilst we were there were 3 terror attacks and the awful fire at Grenfell.
Yeah.
And I still to this day, like it really gets to me. And I remember just sitting there and thinking, there has to be something I can do to help these people. I can't just sit here and do nothing. And although the arts are amazing and they take people away from their day-to-day life and they're a form of escapism, I really wanted to be hands-on part of the solution and helping people. And I was sat on the phone to my mum one day just crying about all these things that have happened, and something clicked in my head and I thought, I have to change my career. I have to go into nursing and help people, and that has been the best decision I've ever made. Since doing it, I have just really felt like this is what I've meant to have done this whole time, and I'm just so happy that that's the decision I made.
Ah, brilliant. That's so lovely. I'm so glad to hear that.
Yeah.
It really feels like you kind of just fell onto the right path almost.
Yeah, absolutely.
Yeah,
Yeah.
that's so interesting. And what was the process like for you? You don't have to go into too much detail, but was it difficult to transition from, an acting degree to a nursing degree, which is obviously science-based, based? Were there any challenges along the way?
When I first wanted to go into nursing, I thought that there would be a lot of challenges and a lot of sort of things standing in my way from reaching that goal. But actually, it was a much easier transition than I initially thought it was going to be. I was accepted onto the course because I already had a degree, so I didn't have to do an access course or anything like that, which was really helpful.
Yeah.
And when I was in my interview, the lady that was conducting it, who was a qualified nurse, she said, "Oh, I've seen that you've done a degree in acting. That's going to help you more than you know in this career." And it really has. It's been quite. I like I said, I thought it was going to be a really difficult transition, but actually, it's there's a lot of similarities in acting and nursing, and with student finance, that was quite an easy transition as well, because that was one thing I was worried about. Was already did a degree, so I've already had finance. So what's the deal there? And
Yeah.
they actually accept you for student finance for a second degree if it's to do with nursing. So
Wow.
yeah, so that was
Good.
really helpful
Yeah.
too. Yeah.
Okay, so it seems as though it's a lot smoother than maybe you thought it would be, which is great,
Yeah.
And you already touched a little bit on what I was going to ask about next, which is how do you find that your acting degree and your acting training has helped in your nursing career so far?
So it has helped. I mean, I think the biggest thing is my confidence with speaking to people. I can go onto a ward with 6 people on and just say good morning everybody and chat to everybody because I have that confidence from acting. And I think that's something that people who've gone into nursing who don't necessarily have that background, that's something that they need to work on. They need to build their confidence, and it was good that I already had that there. And it's quite interesting, actually. I've spoken to a few nurses and student nurses who have previously done performing arts before. So I don't know why, but it seems like quite a common theme, really, that people have gone from performing arts and acting into nursing, which is quite interesting in itself. But there's certain things that perhaps I need to hide my emotion or change my facial expression. So I don't know, for example, I did a placement in Macmillan, which is cancer research. And I did a placement on the Macmillan ward, and that was really tough. I found that incredibly emotionally draining and hard whilst I was there. But being an actor before, I could put on a brave face and be that strength for people when they needed it. And I think that really, really helped me, especially on that placement, just being able to be strong and be brave for the patient and for that person when they needed it.
And would you say that it might also be a good coping mechanism for yourself? Because as soon as it feels like it's very difficult to deal with, you can choose almost in a way to step in the shoes of a character, the kind of like the nurse character who, and that maybe helps a little bit detach you from maybe those feelings so that it's not so hard hitting. I mean, I'm sure at some point it does hit you, probably eventually, but in the moment, to be able to face it, would you say that it's kind of like a bit of character work almost?
Yes, yeah, absolutely. And it relates to, I spoke recently to a few people about imposter syndrome. You feel like you're an imposter. You might not feel like you're good enough, or you can't do the job properly in what you're doing, and you feel like you shouldn't be there. And I had that a lot right at the beginning of my training, and I still get it now. I feel like gosh, how are they trusting me to do this? I can't do that. But that comes in with that resilience, like you're saying, putting on the nursing role and doing some character work. And it was sort of faking it till you make it. And I just put on my nursing hat. I was a nurse that day, and that really helped me believe in myself and build confidence that I got the skills, I've been taught the theory, I can do this, I know that I can be a good nurse. So absolutely, yeah, it's really beneficial for resilience and confidence.
Yeah, absolutely. And it sounds almost like, even though, you know, it took you maybe a longer while to get there, the acting side, or the acting interlude of your career path, was actually important and needed, and it's now proven to serve you in a really good way, in order to do this job that you really want to be doing, which is amazing. I'm so glad to hear that. And it also ties in with something that seems to be like a reoccurring theme in these interviews. We don't always start off on the path that we end up on, or the path that we start on takes us on a few detours until we get to the point where we really want to get to, which is really interesting, because I think young people are often told, you know, they have to choose very early on what they want to do. Like you said yourself, like, I never knew what I wanted to do because I have so many hobbies and so many passions. And I think it's important to bear in mind that we need to just allow ourselves to explore, even if that takes us on a 3-year acting degree for then you know, to end up doing nursing 3 years later. So that's yeah, really lovely. Sounds like you had a very interesting journey so far. Let's talk a little bit more about nursing itself, and I was wondering if you could tell us what a typical day in your life is like right now.
Wow, that is a big question. I think the thing with nursing is there isn't a typical day. It's so changing. Medicine in itself is so fast paced and changes constantly. We find new research, new medicines, and particularly with COVID, I'm sure we've seen how quickly medicine changes. We found a vaccine pretty quickly, an effective vaccine, and so a typical day is very untypical in a way. Um, every day it changes. At the moment, I'm on a theory block, so most of my days I'm doing my assignment, or I've got lectures which are all online at the moment. But when I'm nursing, we have different placements. So we spend weeks in different sort of areas of nursing, whether it's surgical, community, medicine. And my last placement I did was in theatres, and that was incredibly interesting. I got to see colonoscopies, endoscopies, and loads of really interesting things. And being a student, I think that is the best part, is that it changes so day by day, it changes so much. You get to see so many different things, and you get to really find an area where you're passionate about.
Mm-hmm.
So yes, a typical day is not very typical at all, really. Depends where you want to be, depends where you want to work. I know that I want to work in community, so for me, I've got a job as a pediatric. I've got a job as a practice nurse, and that is working in a GP practice. And we'll have clinics. So I've been doing some healthcare work there, where I've been doing vaccination clinics. So I've been giving flu vaccinations and shingles vaccinations, and every day just seeing loads of people and giving them an injection and sending them on their way. And it's very fast paced, but I really enjoy it. It's amazing.
Mm-hmm. That sounds great. So you said you wanted to carry on in the community sort of area, right? So you're absolutely sure now that that's the sort of route that you want to go on, or are you still thinking of exploring other potential areas of nursing?
So with nursing, I think people don't often realise how many paths there are to go down. There's so many different career choices, so many different avenues you can travel down as a nurse. And for someone who loves everything, wants to do everything, it's a great career, because you can change what you want to do pretty quickly, and go into a different field. For me at the moment, I know that community is my passion. I love working in the community. I'm really passionate about food and health, our nutrition can help beat disease, and prevention is better than cure, which is what the NHS always say, because it really is. And working in the community, you're primary care, so you're the first person that anybody may see when they're seeking medical help or medical advice. And it's a great opportunity to make changes and help people change their lifestyle and the way that they live to improve their health. But also, I really love oncology and cancer care, and that's something that in the future that perhaps that's an avenue that I'll go down and work in oncology and cancer care, and maybe within the Macmillan unit, because I absolutely love that. I know at the moment ward care isn't necessarily for me. I didn't really enjoy working on the wards, and I think it's because I found it quite heavy going, and it was quite monotonous. There's a lot of drug rounds, and it's a lot to do with personal care and caring for people whilst they're already ill. And what I like about the community is you can prevent them from going into hospital. You can help prevent their illnesses and stop them from ever having to go into hospital at all.
Yeah.
And I think that's something that I'm really interested in. But yes, there are so many different avenues you can go down. You can do school nursing, health visitors, which is with babies. You can do pediatrics, mental health, learning disability. There are so many different avenues, and I find that really exciting. And I probably haven't discovered half the jobs that there are out there either.
That sounds really exciting, and I think you're very right. We don't often think that, I mean, I didn't for sure, that there are so many avenues within just this one sort of job field or career field of nursing, which is extraordinary, because it means that you don't have to be stuck in a position or area for too long if you feel that for whatever reason you're no longer excited or passionate about it. You can always just change it up, to keep it fresh. You said as well about working in the community and this whole idea of prevention. I think that's extraordinary, and I think that's definitely a direction in which the world seems to be heading more and more now. What can we do to prevent things rather than having to then fix later on, which I think is great. Wonderful. So no typical day for a nurse, which keeps it fresh all the time, which is exciting. And so I was wondering now if you could tell us, so far in your career, what has been the most challenging aspect of the job when you have been in placements?
I think as a student, balancing practice, being on placement, and your academic work is extremely challenging. You have to be very disciplined to be able to get all your assignments in on time, as well as working 37.5 hours a week on placement. So it's incredibly tiring. You do have to be quite strict with yourself in order to pass those exams. But also, I think in general, nursing at the moment is incredibly understaffed, and that in itself is a big pressure, and especially that passes on to students, as we have to be assessed when we're on placement. We can't just go off and do our own thing. You need to be with an assessor who is watching what you're doing and making sure you're safe and you're doing things right. So if you're short-staffed, that's not necessarily always possible. So at the moment, it is quite a challenging degree to do for sure, and challenging career to go into. There's a lot of pressures in it, especially with the pandemic. We've seen a lot of nurses who are suffering from PTSD from what they've seen and are off sick with COVID themselves. But, that being said, I absolutely wouldn't change this career that I'm going on, as there are so many rewarding aspects to it as well.
Yeah, absolutely. So then if we go on to the positive side of things, what would you say that has been the most rewarding thing?
There are so many rewarding aspects of this job. I've always said the thing that I love the most is meeting so many different people and hearing so many different life stories. it's such a privilege to meet these people. And my stepmom is a nurse as well, and she's met some incredible people. And I always say to her, you should write a book, write them all down about all these people you meet, because it is truly amazing what people have been through. The resilience of humans is incredible to hear what people have gone through and how they've coped with it and how they've come out the other side. And it's truly inspiring. And I just love that. I really love hearing that.
Oh, that's lovely. Yeah, and I think that's probably something that can feed you. I can only imagine, because I feel like oftentimes, and especially right now, there are moments when you can lose your faith in humanity a little bit. It's normal for it to happen. And I think, hearing all these stories of resilience and how people have persevered despite their many, many challenges, can definitely restore your faith and kind of give you a boost of positivity and energy. So yeah, that
Absolutely.
sounds like a lovely sort of rewarding aspect to have in any job. Lovely. So what I wanted to ask next, which is not something that I was planning to ask, but I thought I would ask anyways, I hope you don't mind, is would you at all consider returning to acting in any way? I have some friends who are both of them psychiatrists actually, and they both kind of couldn't say no to one or the other, so they kind of still active to some degree within the creative field. So I wondered if that's something that you may consider at some point in the future.
Yeah, that's something that I have thought about quite a lot. I always think, how can I merge the two, nursing and acting? How can I do both? And I think at the moment, particularly, there's a lot of medical professionals who are in the public eye, such as Dr. Ranj and Dr. Alex George and people like that. There's quite a lot of people who are in the public eye and do sort of mix the arts and the medical profession as well. So it is something that I have been considering. And like I said about the book, writing a book about all these amazing people that you meet, and I have thought about maybe writing a play about nurses and different people that they meet. I really loved comedy acting when I was studying acting, so I did think of writing a farcical, maybe comedy play about nursing and what it's like. And because I do have quite a lot of funny stories about things that I've maybe gotten wrong, or it's small errors that I've made that are quite funny. So it is something that I have really considered. I wouldn't ever give up nursing to do acting, but I would love to find a way to do them both.
To do them both, yeah, no, that sounds really exciting. And I think what's really interesting, and again, it's a reoccurring theme in these interviews, probably because I had so many artists on here, but it's interesting that they all said the same thing. It's like, even though we've chosen whatever field it was, whatever artistic field, as a career path, we also can kind of see the benefits that it has on us just as people. So I think it's really interesting that by writing that play or by writing the book, it could just be a creative outlet, and if it leads to you doing something else, like being a little side gig or something, it would be great. But even just having the tools to just do it, like, just maybe if you hadn't done the degree, you would have never thought, I could write a comedy about being a nurse, and that could be very cathartic for you, maybe, in a way, dealing with some of the things that have happened in a funny light. So I think it's really good to encourage young people to kind of think about keeping their hobbies and keeping those passions alive, whatever jobs they choose to go into, because I think they are so important in order to cope with the difficulties of life, and they appear in any career path. No job is easy. So yeah, that's really interesting. Well, I do hope that you find a way of merging the two together. What I wanted to ask as well is, what would you like young people to know about this career path? Maybe something that you wish that you knew when you were a little bit younger or before you started on this path.
It's a really interesting question. Um, I think, like I mentioned before, it's really important to know that nursing isn't just one job. You're not just a nurse. I think a lot of the time, nurses are seen as that's their whole personality. You are a nurse, you have to be a nurse at all times. And it is actually amazing how many people have said to me, "Oh, can you just look at this rash for me just for a second?" Like, no, I'm not on duty, I'm not working, I'm not even qualified yet. So, no, I'm not going to look at it. Um, but it's really important to know that I'm a person who loves to express myself. That's why I went into the arts to begin with. I have piercings, I have tattoos. I like to express myself aesthetically. And I think there's a stigma that you have to be trim and proper and smart, and you can't have piercings and you can't have tattoos. And that's not the reality of nursing anymore. You can express yourself, you can be you and still be a nurse. And I think for me, that's what put me off to begin with. Is if I can't express myself aesthetically and be who I want to be, then I don't want a job that limits that.
Yeah.
Nursing absolutely does not do that. There are so many avenues you can go down, like I said before, and you can find something that suits your personality as well.
Yeah.
So yeah, definitely that would be one thing that I would want young people to know for sure. It's such a rewarding job, and you don't have to change yourself to be a nurse. A nurse is your job, not who you are.
Yeah, yeah, absolutely. I have to say that I also thought, to a degree, that it may be the case that when you were a nurse, you can't express yourself like you were saying aesthetically. But I'm so glad to hear that things have changed in that way, and that you can, just be who you are, and not feel as though you have to sort of fit into whatever mold
Yeah,
of a nurse, which is really great, and it's very encouraging, I think, for young people. And one other question, if you don't mind. I was wondering, with all the pressures of the pandemic and what's going on at the minute, and also with the fact that you were saying that at the minute nursing is very understaffed, and we've been hearing this really in the news since the pandemic started. If young people feel almost discouraged to choose this path because of all of these pressures, um, is there anything you could say to them that may encourage them and make them think, despite the difficulties of the pandemic, and probably I think even though things may get better this year, I think the effects of the pandemic will last in the health system for a while. So despite that, and despite it being an understaffed sector, um, yeah, I'm trying to get to, is there anything that you could tell them to encourage them or motivate them to choose this career path if they feel that it's something they would really like to do, but they're put off by these difficulties?
I would just say absolutely go for it. There are these difficulties and these pressures, but the community of nurses are incredibly supportive. And I've recently started a nursing Instagram page. And so I've met so many different nurses from all over the world and in this country. And it is just an amazingly supportive community. Um, and it's such a rewarding job. There are so many absolutely amazing things about it. Meeting new people, discharging people from hospital that might have been there such a long time, and you see them go home and be with their families again. It's incredibly rewarding and so amazing. And you're changing people's lives. Just one conversation you might have with someone might change the way that they live their lives and might change who they are. And your support for that 5 minutes in their day might mean absolutely everything to them. So I would absolutely, if this is something you're thinking about, just go into it and do it, because the more nurses we've got, the less understaffed we'll be as well. So
Yeah, absolutely. Absolutely. And I think right now that's really important,
yeah.
especially, I mean, in general, but especially right now.
Yeah.
Great. And can you tell us a little bit about the Instagram page? I didn't know about that, and so that sounds really exciting.
Yeah, it's really, I started it just after Christmas, because I heard one of my friends say that she started one and there was a really supportive community there. So
Mhm.
I thought, oh well, that's quite interesting. It'd be an interesting way to educate people, and to maybe help people who are questioning whether they want to become a nurse. Really sorry about my cat.
That's okay. I just thought how cute.
She wants to join in.
Yeah.
Um, yeah, so I started it because I was feeling quite low after Christmas. I was feeling quite down. I think the same as a lot of people, this past lockdown has been incredibly difficult, because we've been in winter, and it's the third lockdown, is
Yeah.
it? I've lost count. Third um, and I think it's just gotten to everybody, and I was incredibly low and I was feeling particularly vulnerable, and I thought I needed to connect with people who are going through the same thing, who know about what it's like to be a student nurse. So I created this Instagram page, and it's been amazing. I have met incredible people. I've collaborated on different posts with people, with other student nurses and nurse qualified nurses,
Mhm.
and it's been an amazing way to share information about health. Um, I've recently done a post about women's health and how it's very under researched, and I don't think many people really realise that. So I found it a really great way to put information out there and to connect with other people. So I've loved it. It's been
Yeah.
amazing.
That sounds lovely. I'll make sure to link it in the description box if
Thank
people would like to have a look and follow you and see what you get up to. I think
you.
that's really exciting. I didn't know it was a thing, but recently I've discovered that a lot of health professionals actually have Instagram pages, and they use it as a way, like you said, to share
Yeah.
information. And I started following a lot of doctors and a lot of therapists, and I think, it's not gonna replace actually speaking to a professional or anything like that, but it's a good starting point. It may get you thinking about certain things that you haven't before, and make you think, oh, maybe I should check in with my doctor or with my nurse or with my, I don't know, with a psychologist about whatever issue. I think that's really good.
Yeah.
And we use social media so much right now that I think, it's a really good way of gathering information. So that's really exciting. I'm definitely going to check it out as well.
Thank you.
Brilliant. Well, I've come to the end of my list of questions. But is there anything else at all that you would like to add? Anything that you feel that we may have not covered and you wanted to mention in the interview?
Yeah, I just want to make it, um I suppose I just want to express how amazing nursing is. I have truly found my passion in nursing, and I know that this is a career that I want to stay on for as long as I possibly can. Um, and if you are thinking about doing nursing or thinking about going into the medical profession, whether it's healthcare assistant or doctors or nurses, I think it's such an interesting profession. There's so many different avenues you can go down, there's so many different things you can do, and you really are making a difference to people's lives. And even if you're not giving them specific treatment, not treating them yourselves, just talking with people and being open and starting conversations is so important, especially around mental health and things that are normally seen as perhaps a taboo topic. You can start those conversations and people will listen to you because you are a medical professional. So yeah, I just really hope that if anybody is watching this that are thinking about going into nursing, that I can encourage them to definitely go into it, because it's just amazing. I don't know how to express it, but it's such an amazing career. It's really rewarding.
Yeah, thank you so much for that, Elise. I'm really grateful to you for sharing your time with us. I know time is the most valuable thing we can give to others, and I'm really grateful. And I know that it's not been an easy period for you with everything that's going on. And like you said,
doing your practical side of the course and then all the assignments and everything. So I'm really, really grateful, and I'm very glad we managed to have this chat, because it's really been inspiring. And yes, I hope that the young people watching will be able to take away a few things from our conversation today, even if it's just realizing that actually nurses are so important. Which in itself I think is really important, because we need to give credit where credit is due. So yes, again, extremely grateful. Thank you so much, and I
Thank
wish you
you.
the best.
Thank you very much.
And we've come to the end of today's video, everyone. Such an inspirational chat. I really do hope you have a few takeaways from today's interview. And if you'd like to keep in touch with Elöise, you can do so on her Instagram account at studentnurseelöise, which you can also find linked below in the description box. If you've enjoyed today's video, remember to give us a thumbs up, subscribe to our channel, and even share this video with anyone who may find it helpful or inspiring. This is extremely important for us, guys, because it means that we can reach more young people like yourself who may benefit from our inspirational content. And finally, if you'd like to keep up to date with all of our content, then do go over to our channel and hit that notification bell too. Thank you so much for watching, everyone. I'll see you next time.